The movement we are analyzing is Grand Battement à la second. It is a ballet kick to the side.
The kick will be broken down into 3 phases: the starting position, acceleration, and deceleration. We are focusing on the hip, knee, and ankle joint.
In phase 1, the dancer starts with their feet in first position with the toes pointed outward in opposite directions with heels touching. While standing like this, the hip will be in full lateral rotation using gluteus medius and maximus, adductor magnus, longus and brevis, pectineus, gracilis, and all of the deep rotators. The knee joint will be extended using the rectus femoris and all the vastus muscles. Since the foot is still flat on the floor, this is an isometric contraction in neutral position using the soleus and tibialis anterior muscle.
The next part of the kick is the acceleration phase. The hip will be in a flexed position using iliopsoas, sartorius, pectineus, TFL, and rectus femoris. The hip also does some abduction as the leg is laterally kicked, so there is a concentric contraction of the sartorius, TFL, gluteus medius, and minimus. The hip does lateral rotation as well, with the help from the sartorius and deep rotators. The knee in this phase will be extended concentrically using rectus femoris and all of the vastus muscles. The ankle will experience plantar flexion with a concentric contraction of the soleus, gastrocnemius, peroneus longus, brevis, flexor hallucis longus, and digitorum longus. The ankle will also do eversion using peroneus longus and peroneus brevis.
The final phase is the deceleration of the kick, where the leg comes back down toward the body. The hip's first motion is adduction. The sartorius, TFL, iliopsoas, gluteus medius, and minimus will all eccentrically contract to lower the leg. The hip will maintain lateral rotation using the deep rotators and sartorius. When decelerating, the knee joint will concentrically extend because the leg has to stay straight throughout all the movements of the kick. The muscles responsible for knee extension are the rectus femoris and the vastus muscles. The ankle will still be in plantar flexion using the soleus, gastrocnemius, and peroneus longus and brevis. Eventually, an eccentric contraction occurs, causing plantar flexion to be lost so the foot can return back to the first position, which is also our ending position.